Treating nasolabial folds with dermal filler. Is it going to be the cannula or the needle that provides best results? Also, is there a real benefit of providing filler into the cheeks in order to lift or suspend the tissues for optimal results? Let's get into it. Even though the laugh lines or nasolabial folds are one of the most commonly treated areas in medical aesthetics, they're still one of the most complicated areas to do well. And the reason why is because, well, not everyone can get an optimal result. Let's get right into it. The first thing I look at is, does this client have apple cheeks? If they have apple cheeks and as a result a deeper fold right here, then it doesn't matter what you do. You're not going to place enough filler in this area to lift the tissues high enough to reach that apple cheek. It's going to make them look ridiculous. So those clients, I basically let them know, hey, by the way, if I see a really large recession here, a deep depression, we can improve that a little bit by kicking it back to where it was. It's going to be very subtle, but it's not going to fix your nasolabial folds. It's just going to provide a little bit of harmony in the face, which is great. The next thing I look at are grooves versus folds. Whenever I have a client that's coming in with a groove, I tend to use a cannula. The cannula works best because it's a little less precise. However, it doesn't hurt as much. It's also much safer compared to using a needle, and I don't have to use an ultrasound. So in that case, it's going to require a lot less effort on my part in order to provide the same type of results. So I'll go ahead and use a cannula here for anyone who has a groove. Now, if I have a fold, then the fold requires a little bit of work. And the work is I need a combination of thick and thin filler. The thicker filler is going to be placed deeper, and I'm going to do that with a bolus of filler. And to make sure that I do that safely, I will usually take out my ultrasound to identify the depth of the artery if there is one in the way. I want to make sure that I'm underneath it. Once I've done that, I'm going to prop up this area using a high G prime filler. Once that's done, in order to help the fold out, right, then what I can do is I can actually take a very thin filler and then I can scrape the underside of the dermis and I can do this area with a needle. And I'm going to just basically place a little product right here on top of the muscle in order to help prop up that nasolabial fold. And this is where things get a little tricky. You can't really overdo it here because if you do, it might look good, but it's definitely going to block the smile. A less is more approach always when it comes to dermal fillers. However, sometimes you need a little bit of the combination when dealing with folds. And now to answer the question, can dermal fillers be placed into the cheeks to reposition the tissues and fix the nasolabial folds? And the answer is no. And the reason why is because it is not a facelift. Facelifts will take your tissues such as your skin, your superficial fat pads, and your SMAS and lift them up. Dermal filler is just a wet gel and you're placing it on a wet surface. And the only way that you're going to kind of lift this area is place so much dermal filler in here that you're going to look alienated. In fact, there was a study that was done proving that 3 mils of dermal filler into the cheeks was still not enough to fix nasolabial folds. And they proved it by doing imaging studies before and after. And on all 77 clients, not one of them had an improvement of their nasolabial folds. In my opinion, go ahead and treat the nasolabial fold itself, but revolumizing the cheek is a completely different service designed for people if they want to restore cheeks that have lost volume, not to treat the nasolabial folds. Hope this helps, guys. If you're serious about medical aesthetics and you'd like to see this done on real clients, then consider joining my Patreon designed for serious medical aesthetics providers just like you. Till the next time, take care of yourselves, exercise daily, and please be nice to absolutely everyone. Cheers!